A procedure considered oral surgery when it involves cutting or manipulating the tissues inside the mouth or the jaw. Some of the common types of oral surgery includes pathology, jaw surgery, sleep apnea, tooth extraction, cosmetic surgery, trauma, and dental implants. Maxillofacial or oral and maxillofacial surgery is a branch of surgery that involves surgical procedures in the head and neck. These include, again, the cosmetic surgery, oncology, corrective jaw surgery, or sleep apnea surgeries. What happens during oral surgery is first, you would call us to make an appointment. I would come in and evaluate your medical history, go over that, see if there's any contraindications. We go over the x-rays and come up with a treatment plan. I discuss the risks and benefits of the treatment plan, and then we discuss the options for sedation, whether it's local anesthesia, you'll be awake, IV sedation, or general anesthesia. And after that, you make the appointment and we proceed with the procedure, whether it is in the office or hospital. Your regular dentist can perform oral surgery. These are usually minor oral surgery. This depends on their qualification, and many dentists do a good job at removing wisdom teeth or regular teeth removal, dental implants. However, oral maxillofacial surgeons are specialized in this and can reduce the risks. You should prepare for oral surgery by going over the treatment plan with your surgeon and listen to the instructions for surgery, or going over the pre-op instructions. This is very important. If you're going to have IV sedation, you should not eat or drink 8 hours before. And typically you should take your regular medications unless you are notified by your surgeon. Anesthesia options available during your oral surgery include local anesthesia. You'll be awake, laughing gas, or nitrous oxide. This is a mask that is placed on your face, but you'll still be awake. It just calms you down. IV sedation is what we usually do 3-4 times a day at least, and an IV is inserted in your hand and medications are given. You'll be in twilight zone and sometimes in deeper twilight zone, but you will be breathing on your own. And occasionally we have to do general anesthesia. This will take in the hospital, usually for corrective jaw surgeries and chin surgeries. Do the procedure under general anesthesia. You can drive yourself to home after oral surgery only if you have been given local anesthesia. I personally, in my office, I have a policy that I do not let people go home alone after IV sedation or general anesthesia. You have to have an escort to take you home. You can minimize pain or discomfort after oral surgery by not consuming alcoholic beverages for at least 10 days. Do not smoke for 10 days and do not use straws for 10 days. Using a straw to drink removes a blood clot and creates a suction, and you may get a dry socket. Also, staying on liquid and soft diet helps with the healing and therefore less pain. You must take your antibiotics if given by your surgeon, and take the pain medications as directed. Recovery from oral surgery varies. It depends on your surgeon, their surgical skills and gentleness. It depends on the patient. But in general, recovery from any surgery is a process. Every day you will see that you feel better. Oral surgical procedures are a little bit different than other surgeries because you use your mouth every day, every time you eat. So it's difficult for healing. So first 2-3 days is always some soreness. And then after that, it gets better and better. If you stay on more liquid diet and soft diet, you feel better and heal faster. Typically, especially in Manhattan, people have busy lives and go to work. I suggest after wisdom teeth removal, you take 2-3 days off, and usually people do it on Friday, and by Monday you can go to work and have a light work type, like less talking and less walking around. Insurance covers part of the oral surgery. Usually there is a copay that you have to pay. This depends on your insurance type, whether it's PPO or HMO. Our office accepts PPOs and some of the HMOs, and my office staff will be happy to go over the copays with you. If insurance doesn't cover part or all of your oral surgical procedures, financial institutions that work with us offer you some benefits that are interest-free payments for 6 months, 12 months, or 24 months. As long as you pay your monthly payments, the interests are zero. And this has been very helpful for our patients. You can schedule an appointment by calling our number 212-480-277 or visit our website at omsfmy.com to discuss about any procedures that you may have. This is Dr. Jamali again. I hope I have answered some of the questions that you may have. And if you have any other questions, please call us at 212-480-277.